Hi, welcome to Iron's Health Talk with Dr. Akram. I am Akram. In this program, we will be talking about all kind of different health issues with different experts in the field. Today, we will be talking about arthritis. So sit back, relax, enjoy your time with us. Arthritis is a common condition that causes pain and inflammation in a joint. In the UK, more than 10 million people have arthritis or other similar conditions that affects the joints. Arthritis affects people of all ages, including children. Osteoarthritis is the most common type of arthritis in the UK, affecting nearly 9 million people. In the UK, rheumatoid arthritis affects more than 400,000 people. Let's look at the history. Evidence of arthritis and potentially inflammatory arthritis has been discovered in dinosaurs. The first known traces of human arthritis dates back as far as 4500 BC. In early reports, arthritis was frequently referred to as the most common ailment of prehistoric peoples. Evidence of arthritis has been found throughout history, from Otzi, a mummy circa 3000 BC, found along the borders of modern Italy and Austria, to the Egyptian mummy circa 2590 BC. There are over 100 types of arthritis. The most common form is osteoarthritis, a degenerative joint disease. Today in our program, we're going to talk about osteoarthritis and post-traumatic arthritis. So let's look at more detail about these two conditions. And for this, please welcome our special guest, Mr. Farid. He's one of my good friend and we've been working together for a long time. Farid, how are you?
Hi Akram, how are you doing? Thank you very much for inviting me on your program.
Farid, you are an orthopedic surgeon. How long have you been working as an orthopedic surgeon?
Well, it's going to be about more than 17 years being in that practice, working in orthopedics and different form of surgery, like I've done general surgical practice and plastic surgery, but overall about 17 years in this practice.
17 years, okay. We'll talk a little bit about arthritis. Have you seen a lot of arthritis in your practice? Is it common?
Yeah, so Akram, as you said, the arthritis is a very, very common condition, and
before we go in detail, I just want to tell you, you would have seen lots of arthritis. Is that right?
Oh, definitely, yeah. So
okay.
in my practice, essentially my whole practice depends upon arthroplasty and dealing with different form of post-traumatic arthritis.
Excellent. Farid, tell us a little bit about you, please.
So, as you clearly explained, Akram, in the beginning, that is the history, is a long-standing history for the arthritis.
Oh, and sorry, no, I was asking, please tell about you. Who are you?
Well, I am as an orthopedic surgeon at Poole Hospital in UK, and my whole practice is mainly dealing with trauma, that involving lower limb trauma essentially, and arthroplasty that involves hip arthroplasty, mainly revision hips and periprosthetic fracture fixation. I've done a lot of operating lists with Akram as well in the past. And now here we are together on this program.
Amazing. Farid, I'm glad to have you here. You live really nice part of the world, isn't it, in UK? It's Bournemouth. Nice beaches, sun. How is Bournemouth now? How do you did you go to the beach in these days?
Yeah, it's lovely weather, Akram, and we are lucky to be living in this part of the world. Recently, because of the COVID, things has not been really great, but again, the weather has been really good, and now the beaches are almost full.
Beaches are full, all right.
Really, it's really crazy here in Bournemouth and in different beaches around Poole and Bournemouth area. And as you know, that is the most popular destination for the people to come over, and especially the kids are enjoying all the holidays. So I think the whole of the weekends people are spending in UK and in Poole and Bournemouth area these days.
Amazing. The good news is, whatever they're doing in Bournemouth and Poole, probably is helping to prevent a little bit of arthritis. We'll talk more in detail a bit later, Farid. Yeah, so guys, this is a live program, so call us on 0203 515 5788 if you have any questions or suggestions, or write to us healthtalk@intv.co.uk, and you can also follow us on Twitter and Facebook, Iron Health Talk with Dr. Akram. And of course, you can watch us on Facebook Live, intv.co.uk. Okay, let's go back, Farid. Let's talk the business, okay? What is this arthritis about? What is it?
So the arthritis, we will talk, Akram, in this program so that the general public can understand in a lay term what arthritis is, what different types are, and how to avoid going towards surgery, and if at all they end up in the surgical options, then what options do they have? So arthritis is basically a combination of like a Greek word arthron, which does mean the joint, and the itis, it means inflammation. So if you combine these two,
you're telling it's a joint inflammation. Simply.
Yeah, it is mainly a joint inflammation. It can be a combination of a systematic disease like rheumatoid arthritis that involves generalized whole of the body systems along with joints as well, or it can be isolated disease of the joint that
So it can be isolated to the joints, or it can be not isolated. It can happen all around your body, isn't it? Other organs as well.
Around your whole body, involving your whole body system, like different muscular.
It affects your heart as well. Is it something, isn't it?
Yes,
okay.
That's true. So as I said, the most common form of arthritis, and you mentioned as well, is the osteoarthritis. And according to WHO, I think in 2050, about 60% of our population of the world will be affected by the osteoarthritis.
60% of the population?
60% of the population will be affected by the osteoarthritis. And among those 60%, about 2/3 will be among severely affected people. So you can imagine that how much burden of osteoarthritis.
So, Farid, what you're trying to say, arthritis is not the disease of grandmas and grandpas. High likely we will all have it at some point.
Yes, of course. So after the age of 45, basically what started to happen is the general wear and tear in your joints starts. And that wear and tear, if you don't look after yourself, look after your lifestyle and body habits, then this wear and tear can keep on progressing and lead to generalized joint aches and pain, and can lead to arthritis. Now, as I said, that it is in orthopedic practice, if you talk about, then we deal with very limited kind of arthritis. And as you mentioned, there's about 100 different types.
That's right, yeah.
In orthopedics, it is important to differentiate that whether it's just the osteoarthritis or it is some kind of inflammatory arthritis. The inflammatory arthritis normally will be dealt by the rheumatologist. And there are different kind of medications that you can use to prevent your symptoms of having like rheumatoid arthritis or gout arthritis or any inflammatory arthritis.
Excellent, Farid. I think to explain a bit more, let's give a big head up. Let's play a small video. So this is an animation video we prepared especially for our viewers, so they will understand more about what we're going to talk about. Let's sit back and look at this video.
Osteoarthritis is the most common form of arthritis and affects millions of individuals. It is classified as mild, moderate to severe. It affects many parts of the body, including the knee. The knee joint is made up of the femur, tibia, patella, along with the synovial membrane, which contains synovial fluid. Synovial fluid acts as a lubricant in the knee joint. The end of the femur is covered in articular cartilage, which moves against the articular cartilage of the tibia. In a healthy knee, the articular cartilage is smooth without fissuring, and the bone is smooth. The synovial fluid is viscous, aiding in lubrication. The knee can move through its range of motion without pain. Over time, osteoarthritis affects the bone, cartilage, and synovial fluid of the knee. With mild knee osteoarthritis, you will begin to have discomfort in the knee joint. Though the joint space appears normal, the cartilage matrix has begun to break down from a combination of wear and tear and increased production of degrading enzymes. In addition, bone spurs, known as osteophytes, may begin to develop on the edge of the joint. These small, smooth, dense growths of bone are part of the body's natural response to the loss of cartilage. Progression of the disease may be slowed at this stage by increased exercise and weight loss. With moderate knee OA, changes in the joint are much more evident. The cartilage surface between the bones has begun to erode, narrowing the gap between the femur and the tibia. Hyaluronic acid, which helps synovial fluid lubricate the joint, is now becoming less viscous, elastic, and concentrated. Osteoarthritis often affects the subchondral bone, located just underneath the cartilage. Subchondral bone provides hydration and oxygen to the cartilage. As subchondral bone flattens and tries to repair itself, cytokines and proteins are released into the synovial fluid. Osteophytes may increase in number and size, making the bone rougher. All these factors combine to make joint pain more severe and long-lasting, both with movement and at rest. Weight loss and exercise, pain relievers, HA, or steroid injections are commonly prescribed treatments. With severe OA, conditions worsen dramatically. The joint space has become far narrower, causing more rapid and severe destruction of the cartilage. The knee becomes inflamed and sore. Synovial fluid is decreased, increasing friction and pain during movement. Within the synovial membrane, destructive proteins are produced which further degrade cartilage and soft tissue around the knee. Osteophytes continue to develop. Bone moves against bone, not cartilage. Mobility, activities of daily living, and quality of life are severely impacted. Treatment for severe OA is typically surgery by receiving a partial or total knee replacement. If you are suffering from knee osteoarthritis, speak to your physician to discuss treatment options.
Thanks. It's an amazing video. I'm going to thank especially to the YouTube and its providers. You have done a great job with this video, and it is really helpful for our viewers and YouTube viewers. Farid, welcome back.
Yeah, thank you, Akram. It was quite informative video. I hope people now understand a bit better what the arthritis can lead to and how important it is to adopt a healthy lifestyle and to prevent going to that stage that you need kind of a knee replacement or a hip replacement.
Excellent. Quickly, Farid, let's summarize what is osteoarthritis and what is traumatic arthritis.
So osteoarthritis is a condition of the joint when joint cartilage started to wear off. And once the joint cartilage started to wear off with the passage of time, then the bone, the balance between the different ligaments and the knee or the hip, it just goes out of balance. And then patients started to have pain in their knees, swelling, and decreased range of movement. And with the passage of time, the whole of the cartilage, sometimes it disappears and you end up something called bone-on-bone arthritis, which means the bone is rubbing against the bone, and that can be a severely quite disabiliting symptoms, and the patients are crippled and they cannot really walk, and sometimes they are end up bedbound after this kind of this kind of a condition. Now, it's important to understand that this is not something dangerous. It is a benign condition, which means it can be prevented. It can be, you can live with it if you control the symptoms. But it is basically a lifestyle modification thing. If you adopt a healthy lifestyle and you control the symptoms, then you can live with that condition.
So you said a really important point there. This can be prevented, and you can adjust to live with it. Is that right?
Yes, that's absolutely true. I have seen in my practice a lot of patients like that who, when you look at their X-ray, you say, oh, it's a severe osteoarthritis. And when you talk to the patient, they are not in pain. And they are living with those symptoms by just adopting the lifestyle and by just taking some pain relief, and they can live with it. It means that they don't need to have a joint replacement surgery. If your symptoms are not bad enough, then you should not think of the surgery. But sometimes you see the patients who have mild to moderate arthritis on X-rays, but their symptoms are quite severe. In those type of the patient, you need to think of something different.
Yeah, we'll go in more detail about the treatment and everything, but let's talk a little bit about post-traumatic arthritis.
Yes, so trauma is everywhere, and the trauma is the most common cause of the presentation in the A&E these days.
But are we talking about big trauma? Is it like a car accident, or you're falling from a tree or something, or is it like day-to-day trauma, like is walking around and?
So all these all kind of trauma can lead to arthritis. So, for example, you are walking on an uneven road and you have a sprain to your ankle, and that sprain can, if it did not heal properly or you don't treat it properly, then this can lead to long-term changes in your joints. So what happens? All the joints, as you showed in your video, they are covered with cartilage. And when you have any kind of a sprain or a fracture through the cartilage, so now post-traumatic arthritis happens only if you have any injury to your joint or any fracture that goes into your joint. So if you have a sprain means you have sprained any joint, like say for example you have sprained your ankle, and it means the ankle ligaments are affected. Once the ankle ligament get affected, it means whole of your ankle cartilage is under a different kind of a stress. So the stress level increases on that cartilage, which means all these forces that will go through that cartilage increases significantly. And that cartilage, when it heals with a different kind of cartilage, which is not designed for weight bearing. In normal joints, you have a hyaline cartilage, which is designed for weight bearing and joint lubrication, and we walk normally. But if you have any trauma that goes into your joint or any ligament injury, then those joints become out of balance, and the cartilage that get damaged end up in something called fibrocartilage, which is not as good as hyaline cartilage. And that cartilage is not weight bearing, and that lead to permanent changes in your joints, and that end up something called post-traumatic arthritis. And especially it happens in ankles and knees.
Ankles and knees,
hips. But ankle and knee are predominantly those joints that will be affected by post-traumatic arthritis.
Excellent. Is there any association between high-fat diet and osteoarthritis? Do you think anything like that?
Well, that's a very good question, especially if you see around yourself day-to-day life, we have a quite irregular, and I would say, the body, the eating habits are not very good in different people. So yes, there is definitely association. We have done a lot of studies in the past on animal studies are done, which have proven that in the individuals, the high fat, the people who take high fat, there are different kind of enzymes that are produced, and they are directly responsible for changes in the cartilage that will lead you to the arthritis. So
that's quite
there are
interesting, Farid.
chemical-
About high fat and other disease, we usually know about heart disease and vascular disease, but about arthritis, this is quite a new thing, or is it? It's been there, we didn't know about it.
Well, I think it has been there for a while, and the paper has been published, and the last one was, I think, in 2012. They have done research on mice, and they compared it to different, they divided them into different groups and gave them, one of the group had a high-fat diet and the other one did not. And they end up sampling the cartilage and seeing what changes they had in those the mice. And they were quite surprised to know that the mice who had high-fat diet, their cartilage showed the changes that are consistent with the osteoarthritis. And once you reduce the dose of the fat among those mice, then the changes can get reversed as well. So it's not that once it happens, it cannot reverse.
So that can be reversed as well. Is that
be reversed.
We're talking about this high-fat diet? Is those mice, or for example, or the patients who were themselves fat as well, or is it just having just normal high-fat diet and you have a normal body posture and you can still have arthritis?
So, Akram, the arthritis is basically, there are two elements to it. One is called mechanical and the other one is metabolic. So previously it was thought that it is only the mechanical factor, that if the patients are overweight, they have injury or something like that, then they can have arthritis. But there is something more to it, which is called metabolic element to the arthritis, which means sometimes the joints which are not weight bearing, they can get affected. So that shows that you have something metabolic component to the arthritis as well. And that metabolic component is, there are a lot of studies has been done, and there is people have seen association with that, like association of high fat diet with the arthritis, or association of being obese with the arthritis. But there is no very clear cut that yes, that is the cause of arthritis. So yes, there are many associations to that, but we cannot say that is what the cause of arthritis is. So in other words, we really don't know how the arthritis happens. But yes, we know that there are certain factors or certain associations which can lead to arthritis.
So that are the things we're going to concentrate, talk about a bit more, and we can prevent those conditions, I suppose, isn't it? For those.
Yeah, so that habits. Is what we were discussing, that is your lifestyle modification. If you adopt that kind of modification, then you can prevent arthritis, or prevent at least the symptoms of having arthritis.
Farid, before we talk more, we're going to go for a short break. But anyway, this is a live program, so you can look at our number on the screen and you can call us anytime and you can ask your questions. If you like, you can tell about yourself, or if you want to be anonymous, you could say a different name and you can ask the questions, and our expert will still give you the answers. And otherwise, you could always write to us on our email or on our Facebook or Twitter link. And so today we are talking about arthritis. This is even though it looks like it's not an important condition, but as according to experts, 60% of us will have arthritis. So it's high likely if two of us are here, one of us will have an arthritis. So this is an important condition. So we talked a little bit about different kinds of arthritis, and we touched upon the diet's involvement. And after break, we're going to talk more about it. So be online and watch. Be tuned to Sky Channel 782. See you after short break.